Hi, I'm Dr. Jaban Moore. Today we're going to be talking about mold and the binders we use to help patients feel better. So let's talk about this a little bit. There's ochratoxin, gliotoxin, aflatoxin are what we're going to be talking about. We're going to be talking about the binders that you use and some of the just different thoughts that you have to have, the knowledge that you need to have so that you're going to get the proper results without making yourself sicker, but also why sometimes side effects happen and other times why more is just simply not better. So let's start off. All right, so the ways that we treat mold and the way that we get binders to work is gentle and being very specific. But you also have to take into account all the other different co-infections and toxicities in the body. So if you're trying to treat mold and you have a reaction to a binder, that doesn't mean it's the wrong binder. That just may mean that what's happening is that binder is stimulating some healing and stuff is getting flushed out of the body and the body can't keep up with it. It can be a reaction to the binder. It can be a reaction to the toxins that are just in your body. So you have to start to learn how to fish that information out and get to know it a little bit better. So start very slowly and be very specific with what you're going for. And if the symptoms don't match the symptoms that should be coming from that type of mycotoxin, maybe you have heavy metal shifting, maybe you're influencing some of the infections in your body. So that said, so more is not better. So many people think, well, if I take a little bit of binder, then what can happen is that's going to get a little bit going, but a whole lot of binder is going to make me get better quicker. And that is just not the truth. So many of my patients that are hypersensitive, that are dealing with mast cell, that are dealing with all of these other different diagnoses cannot handle a lot. And we're talking, if I want to give a full dose to one person, that might be, let's say 90 drops. I've had patients have to start with one drop. So start slow, start low, and build up. More is not better because I don't need patients getting sicker. So if you're out there and you're dosing yourself and you're not working with a physician, I recommend finding someone who knows what they're doing. If not, start low and slow. Binders can be a lot like static cling. I know the word bind makes you think that you got something out there and you're grabbing hold of it, you're going to pull it all the way out of your body. That is just simply not how so many binders work. What's happening is it goes out there and it kind of just clings to it and it starts pulling it and then it gets part of the way out of the body, and if the body's overwhelmed or gets down to the liver, it drops off. Now this is circulating out in your system and your binder gets flushed out. So if you use a lot and your body can't handle that, your liver's not able to flush and your lymph gets backed up, then that's where these difficulties lie. So we've got to make sure that we're using the proper binders, strong enough binders, but also only the amount that your body can handle. Because remember, it's like that static cling. So not all binders are super strong and active. Now let's talk about mold toxicities with binders. Ochratoxin in research has shown that activated charcoals have worked the best for it. Now, not in the research, but out of seeing things in my clinic, there's a step up from activated charcoal, which is bioactive carbons, which is very similar, but they still have that bioavailability of energy because they haven't been burned out like those activated charcoals. So they grab hold of things, but it seems to bind stronger. And that research is yet to come out as far as lab data, but it's coming. Gliotoxins. So gliotoxins, they react best with N-acetylcysteine, bentonite clays, and Saccharomyces. So yes, if you're using those types of binders there, those are going to work best in the research data. And then as far as aflatoxin, it's activated charcoals. Again, anytime I see activated charcoal, honestly, or bentonite clay, I'm thinking bioactive carbon myself in my practice, although I do use these things from time to time just to supplement and to help a patient get through. Also the chlorella, that's on there, and that is definitely a little bit of that static cling. It's not going to actually bind and pull out things super well. So when you're using that, make sure you're using that in combination with these other binders. So just to recap some of the things that I've said today, more is not better. Starting slow and low, making sure that you have addressed drainage first, meaning that your lymph is not backed up, meaning that you go into the bathroom every single day, meaning that you have appropriately set up a movement pattern, so some sort of exercise program, and that doesn't mean going to the gym. That means just simply doing something like this, maybe even add a little bit of this with it, and a little bit of squatting like that, if you're mobile, which some of my patients aren't, to help you flush your lymph. So remember, bottom line, no binder is going to pull everything all the way out. So if you start that cascade of flushing things out, you need to have a strategy of drainage, detox, binders to get it going and start slow and low. And I'm going to keep saying slow and low because you got to start there. Never start full bore until you know what your body can handle. And if you're one of those extra sensitive patients with mast cell, with chronic fatigue and fibromyalgia and all the other things that I work with on a daily basis, it's not about a sprint race. It's about the marathon. Get well. If you have any questions, post them below this. Message us. We're happy to do it. If you want to hear about something else, post that below here. I'm always looking for ideas of things to talk about.